Each of us will remember what happened that day and to whom it happened. We'll remember the moment the news came, where we were, and what we were doing. Some will carry memories of a face and a voice gone forever.
I don't want to be so specific. I want everybody in the city limits of Tuscaloosa to stay sheltered, underground if you can get there until this thing passes.
We're getting some of the rain now on the back end of this storm as it's starting to get wrapped in rain a little bit, but it is a massive tornado now making its way in through the Tuscaloosa area.
This is going to track just to the south of Bryant-Denny Stadium. You can see the stadium right there.
My gosh, look at the debris. The debris field is absolutely huge.
This is a very large and sizable tornado coming right towards the city of Tuscaloosa.
And it continues to strengthen. This tornado is a wedge tornado, multiple vortices on this thing. This is as violent as it gets.
First 15 minutes was quiet, nothing. Everybody sitting around, you heard the normal noises in the emergency department, and then that med control phone rang the first time, and when the phone rang, I think that was really the only time that it rang.
And I actually took the first call from the paramedics in the field, and at that point in time, I don't think anybody really understood the gravity of the situation. We knew that Rosedale Court had suffered a pretty significant blow, but we really, here at the hospital, we did not know that the storm had gone all the way across the city and up into the Holt and Peterson area. But the first call that we got from the paramedics was that we had 3 infants in full cardiac arrest, and there were multiple critically injured patients still in the Rosedale area that they were trying to transport to us.
Ambulances were bringing people in. You would open the back of the ambulance and there would be 15 people, literally 15 people in the back of an ambulance, just piled in, sitting there, kids, adults. And the first patient that I was handed was a little girl, and I asked the paramedic, where did she come from? And they said, well, we got them from Rosedale. I said, well, is this her family? And she said, no. I asked, well, you know, where are they? And we don't know. We don't know who this little girl belongs to. And that's when it really started hitting home, and those medics telling us, those first ones here, is it's gone. It's gone. And they said it's like that across, across Tuscaloosa.
You just jumped in where you could because there were patients everywhere coming through the doors, like put this patient somewhere, put this patient somewhere. And several people in one room, and you just had to go where you could. And you really didn't have any direction. You just had to use your sense and do what you could.
I came into people in the outpatient surgery. They had people in endoscopy. They had people in every hall.
Nurses from other areas of the hospital came down to help. Staff from other areas came down to help. We had doctors that came in that have retired from here or left to go to practice somewhere else that all came in, and it was nice seeing all them. It was kind of like a reunion. Everybody just jumped in and went to work.
We started triage and started moving patients, sending patients. And I walked back into the ER and walked back in, and the entire trauma hall was full, beds on both sides of the hall, physicians down here that we see all the time, but in taking care of patients, nurses just, everywhere taking care of patients. Everybody had somebody taking care of them, and just not asking questions, just getting in and doing what they had to do. It was truly a miracle just how everyone was there. They knew what to do, and they did what they knew to do. I didn't have to tell anybody. They just did it. Somebody would ask, hey, we need this, and somehow we had what we needed. Within a couple of hours into it, we realized that our triage system and the names that we were giving people, we were out. Well, that set off an alarm in my head because we have 450 of those predetermined names, and we're out, and we're 3 hours into this. At that point, we knew that we were experiencing something that nobody ever had. I think we got to page 2 of the disaster plan and put it up because there was not a plan written for this. One thing that sticks out in my mind is when you see a surgeon who is, you know, doing basically PCA care on a patient and takes care of them, helps them to the bathroom, and then puts them back in the bed and takes them to the floor, calls report. You know, that's completely out of the ordinary, but that was just how everybody pulled together. They knew it was their job. That was their patient that they were going to see through. So it was absolutely amazing.
I saw people that had, you know, severe injuries that would put their injuries aside to help the person beside them, and to be patient, and to be, you know, patient for their care, you know, to even help us nursing staff.
And I just believe that we were extremely fortunate to be in the community that we're in. We live in a very caring community, and to have the people that, like some of our people that were nurses that have not worked down here in years, and they came in to help, and just people that came in and just want to do whatever they could, and it just touches my heart. It makes me feel so blessed to be a part of this team. It's just amazing.
I have been at the hospital for many years, and I have never, ever seen the devastation, the looks of fear in people's faces. You know, we had mothers and fathers who couldn't find their children. We had nurses carrying babies around that they couldn't find the parents to. Everywhere you looked, we had people in the hallway, in the cafeteria, that were being treated. I know I worked for a great place, but when I looked at the people that were here helping, that were off duty, the physicians, the nurses, the radiology, the lab, everybody was here pulling together to help the people in the community. And like I said, I've been through a lot. I've never, ever been through anything, and nor do I ever want to go through it again. To look out the windows of our unit and see a tornado go by, and to see the fear on the nurses' faces and the patients' faces that actually saw the tornado go by, was just something you would never be able to describe. To know, too, that we have a God that's there and that's going to help us, and He does that through His people. And the love and the caring that I see people doing right now is absolutely phenomenal, helping each other out, and for that I am thankful.